Hello, I am Susan Digiovanni, the Interim Senior Associate Dean for Medical Education and Student Affairs at VCU School of Medicine. In 2013, we rolled out a brand new curriculum we call the C3 Curriculum. C3 stands for Centered on the Needs of the Learner. Based on the latest in educational research, we try to provide educational tools and learning pedagogy so that the students will achieve success. It is clinically driven. We talk about the patient from day one of the curriculum, and then finally competency-based. This slide is an overview of the 4 years of the curriculum. Like most schools, we have a preclinical phase and a clinical phase. The preclinical years are divided into 3 phases. Students start out in the MS1 phase and take the scientific foundations of medicine. This phase is designed to give students a solid knowledge of science that is common to all organ systems. They then move into the applied sciences, which cover the MS2A and MS2B phases. These courses are all taught by organ system. In addition to their science classes, there are several longitudinal courses that the students will take throughout the 4 years of their curriculum. Some of these include the practice of clinical medicine, physician, patient, and society, and population health and evidence-based medicine. And I will talk more about all of these later. At the completion of the preclinical years, students have time to study and take step 1, and then they move into the traditional M3 clerkships in May of the 2nd year of medical school. 4th year is a time to take the advanced clinical courses and prepare for residency. Next, I will talk about each phase in more detail. The scientific foundations consists of several divisions: molecular basis of health and disease, which is biochemistry and genetics; principles of physiology; principles of pharmacology; infection and immunity, which is basically microbiology and immunology; foundations of disease, which is the principles of pathology, which is common to all organ systems. It includes faculty from multiple departments, as you can see. In each course, our students will interview standardized patients in cases related to the subject that they are studying. They then use our in-house developed computer system to enter the parts of the physical examination that they would do, the laboratory tests and diagnostic studies that they would like to have done, and justify these studies based on their differential diagnosis. In the next round, they will get the results of these studies. They can refine the differential and order more studies until the final round when they have to commit to a final diagnosis. Their group will then get feedback on the cost of the studies they order and whether they ordered the correct studies and achieved the correct diagnosis. So from week 1 of the curriculum, students are making differential diagnoses for patients that they are seeing in a standardized environment. After winter break of the first year, they begin the applied medical sciences. In movement, they will begin the dissection of the cadaver. After they learn about the normal, they immediately learn about abnormal findings and diseases and how to diagnose and treat them. For example, if they have done the dissection of the shoulder and the upper extremity, the next day the orthopedic surgeons will come in and talk about things such as rotator cuff or fractures of the arm and how they go about repairing them. After reproduction, the last course of the first year, the students will have an 8-week summer break where we encourage them to do research or go on one of the trips with groups such as Ombre, where they can go on a mission trip to a foreign country and practice medicine with clinicians from VCU. After that 8 weeks, they come back to the CPR course where they learn cardiopulmonary and renal and genitourinary medicine, and then mind, brain, and behavior, which covers neurosciences, neurology, and behavioral sciences. The latter course extends past the winter break into January. They also have a couple of weeks of board review in January. After getting that, they will get 2 months off to study for Step 1. The longitudinal curriculum consists of multiple different courses. It starts with things like the practice of clinical medicine, physician-patient and society, population health and evidence-based medicine, patient safety course, and then geriatrics. The practice of clinical medicine is where they learn how to become physicians, how to do the actual clinical skills of being a physician, I should say. It starts with boot camp, and boot camp is the first week after orientation. Students will learn on day 1 how to do vital signs, how to take a history from a patient, and how to do a very brief head-to-toe physical exam. In that first week also, they go to the simulation center where they do a all-day simulation exercise, and then they also get to interview their first standardized patient. Practice of clinical medicine course lasts only 3 semesters, so it does not go the 4 years. In most of these semesters, the students will have units where they will get a lecture on the complete physical exam of a particular organ system. Then they will meet in a small group of 6 to 8 students with one clinician where they get to practice that physical exam component. The following week, they will then meet with a standardized patient where they get to practice on that standardized patient that physical exam component. The third semester, there also is a preceptorship built in where the students will go into the community, into a physician's office, and see patients in a clinical environment. There's lots of practice with standardized patients all throughout the 3 semesters of the practice of clinical medicine, and the students have numerous opportunities to hone their clinical skills. Physician, Patient, and Society is the course I nicknamed the Orphan Topic course. It contains some very serious, very important topics that just didn't seem to fit anywhere else in the curriculum or needed to be emphasized on its own, even though it was touched upon in many different courses. It includes things such as career development and professionalism, the physician-patient relationship, particularly from the patient's point of view. We have several patient panels coming in to talk to the students. Integrative and complementary medicine, palliative care, spirituality and medicine, social and behavioral context of health and illness, medical ethics, and legal aspects of medicine. Population health and evidence-based medicine covers epidemiology, statistics, and health disparities. Quality and safety is introduced in the MS2A phase and is part of their interprofessional education. They're taught alongside nurses, dental students, social work students, and pharmacy students. The Geriatrics Curriculum is integrated throughout the curriculum. The students will have TBL sessions in the preclinical years that emphasize the basic science behind aging organs. Students then have several clinical geriatric encounters, including senior mentoring, which starts in their first semester, where the students are assigned to a senior citizen living in an assisted living facility. And this is also in a professional education. There'll be 2 medical students, a dental student, a social work student, and a pharmacy student who will go into the home and meet with a senior citizen and assess them at a course of 3 to 4 visits over the course of the year for different things such as polypharmacy or fall risk in their home. There's a long-term care visit where they go into a nursing home and see somebody in a skilled nursing facility and discuss their patient with a geriatrician. And then finally, the very popular house calls program where students go on a home call with a physician or nurse practitioner into a patient's home in the community. In the M4 year, students will complete a virtual geriatrics case also with interprofessional students as part of the geriatrics curriculum. The third year consists of the core clerkships, which include medicine, surgery, OBGYN, pediatrics, psychiatry, neurology, family medicine, and ambulatory care. In addition, they have 3 two-week blocks in which they can take foundational electives. Foundational electives are things in other areas that students normally don't get exposed to during their M3 year. Specialties such as ophthalmology, radiation oncology, emergency medicine, or anesthesiology, things that students might be interested in going into for their career, but in old traditional curriculums were not able to take electives until their senior year of medical school. So this now enables them to get a taste of what that career might be like and get them starting to think about what they might want to do when they apply for residency programs. The M3 clerkships will finish in about May of the third year, and then the students will progress to the advanced clinical concentrations or the fourth year of medical school. The requirements for fourth year include 2 acting internships, one of which must be in an urgent care area, such as emergency medicine or an ICU. One of the acting internships would be in a core area such as medicine, surgery, peds, or OBGYN. There is a teaching requirement for the M4 student. We believe that the M4 student, in order to be prepared for their lives as residents, need to start thinking about teaching other medical students and other professionals. So all students are required to do some form of teaching in their M4 year. And then the students will take electives in some 300 electives that we offer, various different specialties that will help prepare them for their internship and residency. And then the M4 year is completed with a capstone course in which we go over some final things to prepare them for their internship. Throughout the fourth year, students will be applying for, interviewing, and then completing their match list for the residency process. So what kind of student are we looking for? We're looking for the self-motivated, independent, self-directed learner, the problem solver, and somebody who works well in groups. Our curriculum is very much based on teamwork, team-based learning, and we need students who are going to be go-getters, who are self-motivated, who will be lifelong learners, and who will be active in making sure that not only they, but their classmates are the best physicians that they can be.